Hello everyone, I'm Dr. V. Mohan. I've not been speaking to you all for some time, but I thought now with the raging second wave of the COVID epidemic, I thought it's important to reach out to everyone in general and to people with diabetes in particular. There's also something which came up recently, it's a little worrying about the mucormycosis. So I thought I'll talk about that also in this program. First of all, let me give you, a brief update about what is happening. Now, the problem was that, India has always been about a couple of months or 2 or 3 months behind the West, Europe and US, as far as the peaking of the epidemic is concerned. So when the rest of the world, if you go back to March, April of last year, when we had the lockdown and so on, that time there were hardly any cases in India. And at that time already it had started, reaching very worrisome numbers in Italy and Spain. And we were seeing the kind of things that we're seeing now in the second phase. We were seeing it then. And there was, of course, a lot of fear and so on. And therefore, quite rightly, the government, because at that time, what else can you do? I think the government did the right thing by doing the lockdown. But what happened was that in fact probably worked against us, because it delayed the peak as it was meant to do. But what then happened was that since we locked down too early, the peak occurred much later. So it was in May, June, July, August, September, it went on. And the peak kind of reached at that time. And then luckily, we were not very badly affected with that. If you look at the total numbers that we had in the first wave, it was very small compared to even countries like US. And of course, the death rates were also very low in India at that time. So somehow we felt that, Indians are protected, and a lot of theories behind that. Because it's a hot climate, we don't get it. We have taken BCG vaccination, all kinds of theories. Oh, we do yoga, that's why we don't get it. Ayurveda, all kinds of things. And also, of course, because of the infections, Indians are exposed to a lot of infections, and therefore this will not affect us and so on. Unfortunately, we let down our guard too soon. And we spoke too soon, first of all, and we let down our guard too soon. And so while the whole world was thinking, how is it India escaped? How is it India escaped? What can we learn from India and so on? While all this is going on, and of course, we had series of events and elections and all kinds of things which came in February, March, and so on, and April, which led up to this catastrophic increase in the numbers. Now, this second wave has not been good news. So if people ask me, the first thing is the second wave more deadly than the first wave? Well, as a matter of fact, no. If you look at the death rates even now, although you see all these horrendous pictures and TV, views of all the dead bodies and so on, it's not because it is much more deadly. It may be more virulent in the sense it's mutated. It's a different virus, and therefore there are a couple of things. One is that when you do an RT-PCR test, sometimes it becomes negative. So you falsely think you don't have it. If you have the classical symptoms of a prolonged fever more than 3-4 days, if you have breathlessness, you have uncontrolled cough and severe cough, and if your oxygen saturation drops, if you have that loss of smell and you have loss of taste, it's almost sure that you have the COVID-19. Now, the test may come positive, may not come positive, but then it's almost sure that you have it. And therefore, you have to take all the precautions and isolate yourself. Luckily, like in the first wave, 80 to 90% have only mild disease. And therefore, you can just stay at home, take paracetamol, take rest, drink plenty of water, sit in a well-ventilated room, avoid AC if possible. And very soon you should be on your road to recovery, particularly if you don't have comorbidities like obesity, diabetes, old age, respiratory problems, asthma, or kidney problems, malignancy, all these kind of things we don't have, then usually people recover. But the problem is that usually in older people, but also now increasingly in those with obesity, diabetes, heart disease, and so on, suddenly it may deteriorate. And it's when the oxygen saturation drops, and all of you know this now, every day we're reading in the papers, up to about 92, 93, 94, we don't have to bother. But if it drops below 90, then you need oxygen, especially if it is continuously. Remember that these pulse oximeters can be deceptive, and therefore you may get an occasional reading of 80 or 85, which is wrong. And if you do it 1 minute later, it will come as 95. The second one is correct, because it cannot increase like that in 1 minute's time. But I'm just telling you all things which you probably know. So anyway, the second wave, the problem with the second wave is the real numbers, because the number of people who got exposed was far more than in the first wave. In the first wave, what happened was people of the lower socioeconomic status who could not, sit at home. They had to go to work and they had to move about for their own survival. We found, drivers getting infected, maid servants getting infected, workers getting infected, and so on. The others kind of stayed at home, and they were so scared, reading all about this deaths in other countries, that they took a lot of precautions. Then what happened was, when people got confident, oh, this is nothing, they became overconfident. Then they stopped wearing masks and they stopped the social distancing. They all thought it was over. COVID is over in India. No, it's not over. Even now, it's not over. Even after the second wave, it may not be over. What we are every day, COVID-19 teaches us new things. I have stopped predicting what will happen, because every prediction is proved wrong, including by the so-called big experts in inverted commas. They make one prediction and next day they say the opposite. So there is no point in trying to predict how this is, because the virus is constantly mutating as well. It's like playing a chessboard game, or it's like playing snakes and ladders or something. 1 minute it's there, 1 minute it's there, up there. Stop. I think we should stop trying to predict what will happen. But the thing that we have to do is to take maximum precautions. And if we, I go for a walk in the mornings, and what I find is that even now, at least 25 to 40% of people who are walking are not wearing a mask at all. This is only walking, not even running. For running, you can say you can get a little breathless and so on. But this is just people are walking slowly, and even they are not wearing a mask. Now remember, when the population, about 30-40% of the population is infected, which is probably what I think is the numbers now, at least 30-40% must be currently of the population of Chennai or Bangalore, probably even more, and all the metropolitan cities. Perhaps as you go into the smaller towns and villages, the percentage is a little less. But in the big metropolitan cities, definitely that's a kind of percentage. That means every 10 people you meet, 3 or 4 are having it. Either they know about it or they don't know about it. Either they have symptoms or they don't have symptoms. Even if they don't have symptoms, they can transmit it. Now, you may say, well, I have been vaccinated, therefore I will not get it. There's no guarantee. You can still get it. You may get a very mild version of it. From what I have seen of all, including my own staff, I have hundreds of staff at our center. Now, the first wave, when they got it, many of them were very seriously affected. One of them actually died, unfortunately. Not a very old person, but unfortunately one person died also among my staff. But this time around, if somebody gets it, because most have been vaccinated, they hardly know that they have it. But remember that you can transmit it to others. And I think in a country, it's a situation like this, like a war-like situation, we shouldn't be selfish and say, well, I won't get it and I won't get serious, so I'm okay, so I won't wear a mask. You are infecting so many other people. And when you infect others, it is going to spread and spread and spread in the community. And ultimately, you will only be affected. Your business will be affected. Your life will be affected. Now lockdown has come. You cannot move out. So many things are going to affect you. So you're not living in isolation. You're not living in an island all by yourself to say that, well, I won't get affected. I think we should have a little bit more social consciousness and civic consciousness, and that is why by wearing this mask, so wear either an N95 mask if you're in close contact with somebody, or you're in the medical profession, or in front line, or in the police, or any other thing where you're meeting people. Better to wear a good mask. Otherwise, wear a double mask. That will help to prevent you from transmitting the disease if you have it and don't know about it, or from you from getting the disease. But let me come to something else which I wanted to talk about today. Now, we all know that COVID can increase the chance. I would say it this way: COVID and diabetes, they have what is called as a bi-directional relationship. So what does that mean? So if you have diabetes, your COVID, you can get it also, and if you get it, it gets worse also. So that's the relationship between diabetes and COVID. What about the relation between COVID and diabetes? Can COVID induce diabetes? Well, it can in 3 or 4 ways. The first one is the kind of stress, panic, depression that we had in the first wave. Now people should be worried, but now they're not worried. They've got over the fear of it. But, and I'm not saying that you should have fear, panic, depression. You should not have any of those. In fact, by doing regular pranayama, meditation, controlling your mind, relaxing, you should actually decrease your stress. But yes, at the first time round when it came, the panic, the depression, people sitting at home, the stress, anxiety, seeing newspapers and TV and all that all the time, the social media and WhatsApp messages, most of them fake, frightening them. And so that produced diabetes, because your BP can go up, your sugar can go up. That's the first mechanism. Second, during the lockdown, what happens is most people don't step out. They're not supposed to step out. How many people are able to have a treadmill at home, or a terrace where they can walk, or a gated community where they can walk? So what happens is their exercise goes for a toss, and therefore their sugar goes up, their weight goes up, everything goes up. So obesity increases. Many of them, my patients, were very careful. They actually improved their diet. They started eating healthy, getting more vegetables and fruits and so on. But the other way also it happens, binge eating. People get depressed and they start eating all kinds of junk foods and so on. Although thankfully you cannot order much during the lockdown. So actually on one side the dietary pattern improved, but exercise definitely got hit. Number 3, as I told you, is obesity itself, because of all this staying at home and sitting all the time. Because in an office you'll be walking about, that is gone. You walk to work, or you take you go by bus or by some mode of transport, cycling, scooter, something. All that is gone. Now you're sitting at home in front of a TV, working from home. So obesity chances are high, and obesity is definitely related to diabetes. Number 4, very importantly, is steroid use, and that's what I'm going to talk about that. So steroids, in the first half of the first wave when it came, steroids were not used. They were using all kinds of other things, and they were putting people on ventilator, and we didn't know what it was. They thought it's a lung disease, therefore put people on ventilator. And actually that was not the treatment. We realized it late. You can't blame the doctor. They didn't know. Suddenly a new virus comes and starts attacking people. They don't know how to treat. When people are breathless, they say, okay, put them on ventilator. Today we know that ventilator should be the last thing that you should do, and probably should not put people on ventilator unless you're dying or something. And then afterwards it's very difficult to get them out of the ventilator. But then the discovery came mainly from England, saying that this is a clotting disease. And of course in Italy and other places also they found that. So it's a clotting disease, and therefore maybe the use of anticoagulants is very good. And that was one discovery which came. But more importantly, when we realize the mechanism, why is that people are becoming very sick, and why are they getting serious? This condition called as the cytokine storm was then, they realized that that's what is happening. So your body is supposed to, your defense mechanism, your immunity is supposed to fight the virus and kill it and defend your body against the invader, the virus in this particular case. However, if your immunity is weak, what happens is, like like your countries, if your soldiers are not strong, your army is not strong, what happens? The enemy enters and then takes over your country, as has happened several times in India's history. So it has happened that way. So similarly, what happens is the virus now enters, it is now taking control, it goes and settles down, and the first 1 week is when the viremia is actually the biggest problem. The virus is multiplying and multiplying, it's settling in the upper respiratory tract, in the throat and in the mouth and so on, and it is multiplying. Then afterwards what happens is it gets internalized, and then it starts producing what is called as the hyperinflammatory response, also called as a cytokine storm. Your body is supposed to produce some inflammatory thing, but if that is kind of exaggerated, like a bomb exploding in the body, suddenly there is an outburst of all kinds of toxic substances and cytokines. Now these can go and produce clots, they can produce damage to the lungs, damage to the kidney, to the heart, you can get heart attacks, it can even produce diabetes and other things. So this cytokine storm is in the second phase, not immediately when you get it, but after the 5th day, 6th day, 8th day, 10th day. That is a time when you get it. That is a time when the oxygen saturation drops very rapidly. You have to be in the hospital and you have to be hospitalized. That is when they found out that if you use steroids, because steroids are excellent anti-inflammatory. You know that steroids are given when you have severe inflammation of any type. It's also used for chronic arthritis. It is where asthma doesn't respond to anything else. You give a steroid thing, it works very well. Steroids are miraculous drugs. They're life-saving drugs. When your blood pressure is dropping, you give steroid and your BP will come up. So steroids are life-saving. But remember that steroids can also have side effects. So in a life-threatening situation, in a in a very serious kind of a situation, when the cytokine storm is there, of course you have to use steroids. But even there, the steroids can be used rationally. You don't have to use huge doses of steroids. One of the things that I'm seeing now is people are beginning to take steroids as a prophylactic, saying if I take steroid, I won't get COVID. That's absolutely wrong, because a virus will multiply. If what is the steroid doing? You're actually lowering the immunity. It's a kind of immunocompromised state. It's something like a chemotherapy being given. I'm just giving you a rough example. When you use chemotherapy, what happens? Your immunity is very, very low. Something like that happens when you give steroid, because you're reducing the immunity in your body, you're reducing the inflammatory response. So if you're taking steroids to prevent this from coming, actually it can do the opposite, and it can spread like wildfire. It can spread. And so never use steroids as a prevention, never use it without the doctor's prescription, and never use it in the first phase when the virus is actually multiplying. Only in hospital, in serious cases, as a life-saving measure, it should be used. Now, coming back to steroid and diabetes, it is very well known that steroid can induce diabetes. This has been known for the last 50 years or more, that if you take large amounts of steroids, especially if you are on the borderline, if you have a family history, if you are pre-diabetic, it will push you into diabetes. Ever since the COVID-19 started, I'm getting referrals of patients whose blood sugars are 400, 500, or very, very high due to the steroids. In some of them, when I stopped the steroids, it was coming back to normal. You can't stop it suddenly also. Once you've been started on steroid, slowly you taper it off. And when you taper it off and you completely stop it, sometimes the blood sugars can come down to normal also. I've seen that. But in some, where they were waiting to develop diabetes, this huge dose of steroid that's given pushes you into permanent diabetes. It's just like if you're lean and you don't have diabetes, then you put on weight, you'll get diabetes. By reducing the weight, some of them can reverse to diabetes. Everybody cannot reverse to diabetes as it is claimed in social media. Reversal, reversal, reversal. They keep talking about it as if it's like, taking off your hat or something. It's not so easy. Reversal is very, very difficult. It can be achieved under extreme, with extreme, treatments, and with loss of weight, losing 15 kilograms to 20 kilograms in weight, you'll be able to reverse. So steroid, just because you stop the steroids, you may not reverse your diabetes. Sometimes permanent diabetes can be produced. Now, coming to this mucormycosis thing. What is mucormycosis? You might have read about it today. It has already started coming in the papers, and I understand that in Mumbai, there are lots of cases of this mucormycosis. What is mucormycosis? Mucormycosis is a horrible fungus infection. Many fungus infections, you would have heard of simple fungal infection, the nail, or you have, genital infection, or somewhere in the thrush on the, the tongue. These are all minor infections which will go away. Put an ointment and it will go away. Some of the fungal infections, like in the nails and scalp and so on, takes longer. It doesn't go away that easily, but they're not dangerous. But there are some dangerous types of fungus. These are called a black fungus or mucormycosis. It is produced by a particular type of fungus. Now, what happens is, where does this mucormycosis come? Who are the people who are more prone to get it? Number one, top of the list is diabetes, and that's why I'm talking to you. The moment I heard about this in Mumbai, I thought I must talk to people and reach out to them. So the number one cause of that is uncontrolled diabetes. Anybody with uncontrolled diabetes can develop it, leave alone COVID. But when you are having COVID, you are now treated with steroids. And when you're treated with steroids, this is another reason why you get mucormycosis. So if you're diabetic, your sugar is already not under control, And now you're given huge doses of steroids as a life-threatening thing. Plus, you're getting intubation and you're getting all kinds of things and introduce fungus into it. I'm not surprised that suddenly mucormycosis has started coming. So far, we have had the reports only in Mumbai. But what happens in Mumbai, just like what happens in India, comes 2 months after what happens in US or UK or in Europe. What happens in Mumbai? Mumbai has always been in the lead as far as this COVID-19 is concerned, first wave as well as second wave. So now in Bangalore and in Chennai and in Telangana, Andhra Pradesh, Karnataka, all these kind of places, Kerala, you can expect that if you don't get it right, the treatment, same mucormycosis will start coming. Now, what is mucormycosis and how many types are there? Mucormycosis of 3 or 4 types. The first type is called rhinocerebellar. It starts in the nose. Some kind of a black fungus thing starts coming, and very soon it gets into the sinuses. So if you take a first X-ray, it looks like an ordinary sinus, but very quickly it spreads into the orbit, the eye part of it. The eye starts becoming red, and then proptosis of the eye occurs. The eye starts coming out like that. You can lose vision. And then what happens, there's something called the veins there are called as the cavernous sinus, and that's what connects it to the brain. And from there, it can enter into the brain. Now, if it enters into the brain, it's almost 100% fatal. So people die if you get that. If you get in the initial stages of this rhinocerebral, you can treat it. If it's only in the orbit or only in the nose, there are powerful antifungal agents which should be used. Now, these are very powerful drugs. Okay, there's a drug called amphotericin B, which the older preparations, I've used it. Now, what happens is we use that drug, the fungus gets under control, but it'll damage the kidney. Okay, and so you don't have much of a choice. If you don't treat it, it'll spread to the brain and people can die. If you do this, then it can affect the kidney. Luckily, better versions of these have come. The amphotericin B now comes in a lipid formulation and a lysosomal formulation. 2-3 other improved varieties have come where the toxicity is much less. But prevention is always, of course, if it starts affecting parts of the jaw and so on, you might have to do extensive surgery to remove that. The jaw has to be removed and extensive surgery, and the orbit has to be opened up, and it's not a good disease to get at all. And therefore, what can we do to prevent it? The first and the most important is control your diabetes well. I have been saying this ad nauseum ever since the COVID-19 started. Please control your diabetes. The other day, just a couple of days ago, one of my classmates, rang me up, and his wife had diabetes, and sugars were very high. And I was telling, why don't you start insulin? Blood sugar is 300 or something. And I said, it's a COVID time. Why don't you start insulin? No, insulin is the worst thing that you can do. Is it worse than mucormycosis? So I said, it's for 15 days, 10 days, and we'll say, no, then you'll get addicted. What addiction? Insulin is not an addiction. Insulin is a lifesaver. It is mucormycosis which is a killer, not insulin. Okay, it's steroids which are, not so good if you can avoid it. Insulin has never been a bad thing. What has insulin done to people? Insulin has only saved life. It's a 100th year of insulin, for heaven's sake. It's a 100th year of insulin. 100 years ago, if you were born with type 1 diabetes, you would have died in 3 months' time. Today, if you're alive, it's because of insulin. Insulin is the greatest gift of God. And we have to thank those people in Toronto, Banting and Best and McLeod and Collip who discovered insulin. This is a 100th year. We must actually put a big photo of theirs. Every type 1 patient should have a photo of those 4, because you won't be alive today but for that insulin discovery. So I'm not saying every diabetic should be put on insulin, but if you need the insulin, don't shy away from it. Don't say, I'll get addicted, it's all wrong information. If somebody in WhatsApp is telling you that, WhatsApp University is a bogus university, let me tell you that. So what I'm trying to say is that if your sugars are not get under control, please control it. How will you know whether it's under control or not? Unless you test it, you will not know. So this is a time when you're having lockdown already. Increase the frequency of your testing. Without your knowing, your sugar will go up. So if you're doing self-monitoring of glucose or SMBG, increase the number of times so that you know that your sugars throughout the day are under control. Today, we have small patches. Many of you are using it, I know. A small patch, a small sensor-like thing, like a 2 rupee coin. You just fix it like a plastic thing, put it on your hand, and throughout the day, throughout the night, It tells you what your blood sugar profile is. What is it when you're sleeping? What is it when you get up in the morning, after breakfast, before lunch, after lunch, before dinner, after dinner, when you walk, when you eat carbs, when you don't take carbs? What happens throughout the day? There's something called as time in range, TIR. That's a new one, a time in range. Throughout the day, you must have at least 70% under control. I know many of you have 100% under control. It's like getting 100 out of 100 in your examination. So use that. This is the time to use it. I have found people who have been on steroids. Actually, I put them on this and I tell them, this is the time when your steroid is increasing your sugar. Take your tablet at this time and take your insulin at this particular time and control it. This is essentially what we mean by precision diabetes. Anybody can treat diabetes, okay? But precision diabetes needs a certain amount of techniques, like a good cook and a bad cook. Why do you have the Michelin chefs and so on? They are experts. They are pundits in that. Similarly, any fellow can do some cooking. Even I can do some cooking. But that's not, that's not the thing. A real cook is able to cook fantastic food. Similarly, precision diabetes treatment means that you are actually matching your calories to your sugar, to your carbohydrate, to your insulin or to your tablets, and getting perfect control. It's like a pilot who brings down the plane slowly and so softly that when it's landed, oh, when did we land? I didn't even know you landed. There's some who will land so much, they'll give you such a shock of your life, you'll think you died. The plane just bumps like that. So that's a good pilot and a bad pilot. So similarly, follow precision diabetes treatment. Keep your sugars under control. The simple way you have to do it is, either use that patch or increase the testing. This is the time when you must keep every sugar under control so that COVID will come and COVID will go away like a small cold. It will not affect you at all. It will be as if it's a person without diabetes. And therefore, you don't need to get admitted in hospital. Therefore, you don't need the steroids. And therefore, you don't get mucormycosis. Are you getting the point? That prevention is better than cure. And these are conditions which are much easier to prevent, and you should prevent it rather than trying to get, which amphotericin B is safe and what can be done. Can we prevent kidney failure after taking this and all that? When it comes to that, that's a different question. But the idea why I'm talking to this, not just to patients, but I hope some doctors are also listening to that. Use the steroids judiciously. Try to measure the blood sugar levels. Even when you're treating for COVID, measure and see whether the sugars are under control, and see that the equal importance is given to diabetes control. I wrote an article in the Hindu some time ago where I wrote and said that the non-communicable diseases should not be sidelined by COVID-19. I said COVID-19 is very important. It's very, very important. You have to look after it. It's a life-threatening thing, and it's a pandemic, and you have to take maximum care. But don't forget that diabetes, hypertension, and coronary artery disease kill much more people than even COVID-19. Even with all these deaths that you saw, all the media showing, the bodies and all the crematoriums and all the thing that you saw, the number of deaths is still lower than the average number of deaths due to diabetes every year in India. Did you know that? Well, it's a truth. And the number of people who die due to heart attacks in India is probably 6 times or 7 times more than the total COVID deaths. So people are dying due to diabetes, hypertension, strokes, cancers, much, much more than the total number of COVID deaths in India. The total number of COVID deaths since we started last year is only about 2.4 lakhs. It's a lot of deaths, 2.4 lakh. But consider that 3 lakh people are dying every year due to diabetes. Is anyone even talking about it? Did you even know about it? That so many people are dying, and half of those deaths could have been prevented if only the sugar was well controlled. So my job as a diabetologist, I feel, is to convey this message to you that if only you looked after your diabetes well, if only you control the ABC and followed the ABC mantra. What is the ABC mantra? A1C is A, keep it under 7%, even below 6.5 if possible. B, blood pressure, keep it under control. C, cholesterol, keep it under control. D, discipline. No smoking, moderation or no alcohol. Follow your diet and do your regular exercise. Do some pranayama also. If you do this ABCD mantra, you are protected. Okay, today the prevalence of diabetes in the major cities like Chennai, Bangalore, Hyderabad, Mumbai, Calcutta, and Delhi at age 50-55 is 40% of the population. 40% of the population. This is not made up. This is through actual studies which have been repeatedly done. 40% of the population age 50 to 55 in the big metropolitan cities today have diabetes. Another 35% have pre-diabetes. So 75% of the population, if you're 50, 55 years old, 75% of you will have either diabetes or pre-diabetes. Only 25% are normal. Okay. So when that is the situation, and when COVID is hitting 40, 50% of the population, what is the chances that somebody with diabetes can get COVID? It's very high. And that is why I'm saying, if you keep your diabetes under good control, you can prevent this, mucormycosis completely. There are even more severe forms of mucormycosis, which I'm not even going into, like disseminated, cutaneous, pulmonary. Those are even worse than the rhinocerebellar, and all those are more common in people with diabetes. There are certain other medicines, like which I'm not going to, like deferoxamine, which is used in iron overload conditions. If you have a condition where your iron overload is more and the free iron is being removed from the body by using these kind of drugs, you are very much prone to get this mucormycosis. And I'm just saying that just in case some of you are using that. So maybe using iron supplements during this time of COVID is not a very good idea. You can probably hold it for some time. Also, there's a lot of zinc and all that being used, left and right zinc and all that is being used. Maybe they're not that good. If you don't have a zinc deficiency, what is the point? Vitamin D, I agree. A lot of people are vitamin D deficient. You can take that. You cannot make a mistake with that. But things like zinc and all that, taking it in excess quantities may actually produce harm. Okay. Then, what else is there? Now, let me take, some of the questions which have come. Lots of questions have come. So, first one, Sri Devi. Is vaccines efficient? Even I watched a video on vaccination, but still, sir, will it fight against the virus? There is no doubt that these vaccinations are fantastic. Now, what will the vaccination prevent you against? Will it prevent you from getting COVID? No. The vaccine, the body doesn't know that there's a vaccine inside, and therefore you cannot go. What has the vaccine done? It's built up your immunity. Okay, it's built up your antibody level against the COVID. So when the COVID enters your body, you cannot prevent the virus from entering into through your nose, especially when people walk about without mask and things. How can you prevent it from going inside? Having gone inside, if you do an RT-PCR test, it will come positive because there is a virus. Even there's one virus in your body, RT-PCR is so sensitive, it will pick it up. Okay. Now, what happens now? You have been vaccinated. Here 100 people have been vaccinated. Here 100 people are not vaccinated. Let us say 50 of these people get, the COVID, whereas 80 of them get COVID. So, of course, there will be some reduction in that. These 50 who get it may not even know that they had COVID. Okay, they may not even have a symptom. Only if you go and do an RT-PCR, you'll say, why do you go and do an RT-PCR? Because others in the family who are not vaccinated might have got it. So just as I've been vaccinated, let me also check. I may not have it. Result comes positive. Oh my God, I have it. And they didn't even know about it. That's what the vaccine has done. Just protected you. You did not even know you had it. I have had families where people have been vaccinated, not vaccinated. Those who are not vaccinated do a CT scan. The lung is full of the COVID infection. Those who have been vaccinated, it's clear. Zero. Nothing. The CT scan is absolutely normal. There are tests like D-dimer and ferritin and IL-6 and HSCRP and these kind of tests. If you do those, you'll find they're all elevated in those who have not been vaccinated. Those who have been vaccinated, they're all normal, like a normal person. So you got COVID, but the COVID behaved like a flu, or even not even like a common cold, and it went away. So that is why vaccination has to be done. Then you'll say, oh, but I read, that one guy died in, some place when he took a vaccine and all that, something happened. Well, what can we do? I mean, I'm not saying that a vaccine can never produce some side effect in somebody. There are people, when you vaccinate the whole population, you're not doing tests for everybody to vaccinate and so on. So when you start doing that, some of us have some genetic defect which is slightly abnormal. Not all human beings are the same. Not all 5 fingers are the same. So when you vaccinate a lakh of people or 1 million people, 10 lakh people, about 4 or 5 of that, or 2 or 3 in that 5 lakhs or 10 lakh people will have a slightly genetic thing which is slightly different from the others. And therefore, when you give this vaccination, it may produce a hyperinflammatory response, similar to a COVID. Very few deaths have occurred due to COVID. And if you see the overall benefit ratio, it is far, far higher. And therefore, I think you should. That's the only thing we have. Only 2 defenses we have. Otherwise, you take a risk and say, if I get it, I'll die, suicidal tendency. If you get it, well, if you're lucky, you may still escape. If you're not lucky, you know what happens. So therefore, what can we do? One is wear a mask, try to prevent the infection, social distancing, now lockdown, stay at home, be wise about that, wash your hands, follow all the safety precautions, and get vaccinated. Okay, there are some issues with the vaccine supply and so on. I hope that gets sorted out soon, but you must get vaccinated, no doubt about it. Vadivkarsi Natarajan. Hi sir, good evening. We're staying at home only, same type of food, medication I'm following through. My sugar's always 200 plus. Though my sugar always 200 plus, I'm not worried. Why are you not worried? Vadivkarsi? You should be worried. I would say you should be worried. Sugars always 200 plus is not good. If your sugars are 100 plus or 120 plus, I'll say I'm not worried. If this is not being a very, it's not a good thing to say my sugars are 200 plus, but I'm not worried. I'm not asking you to be worried, but I'm asking you to control your diabetes. Being worried and doing the right thing is a thing. I always drive on the left side of the road, on the right side of the road. When you should be driving on the left side in India, I always say, but I'm not worried. I've never had an accident so far. That's not the way. I never wore a seat belt in my life. I've not had an accident. If you ever have an accident, that seat belt is going to protect you. Okay. I never wore a helmet. Simply they make a fuss about helmet. Only if you have an accident and your head hits the ground, you'll know the value of the helmet. Similarly, keeping your sugar under control is the wise thing to do. Otherwise, I don't think you're being very. So please control what you can see for my sake. Please do it. Surendra Gupta. Dear diabetics, can't we practice deep breathing? Sorry to know, 32-year-old young diabetic, shallow breathing. The oxygen improved with exercise. It's we are responsible. What's happening initially in denial mode, soon things go here. The stone fort washes away lives after life. Dr. Surendra Gupta. Yeah. Surendra Gupta, I agree with you. I mean, deep breathing is, I mentioned pranayama. I didn't read yours. I mentioned pranayama. I said, reduce your stress. I do it every day. So if I didn't believe in it, why would I do it every single day? 365 days I do it. Walking, I do maybe 364 days. I may miss 1 day or 2 days in a year. But this I don't miss. I don't miss even one single day. So I'm a great believer in that. Our ancients have taught us, the value of deep breathing and then relaxing, the oxygenation which goes into your lungs. This is fantastic. We are trying to get oxygen concentrator. If you take deep breath, there's 21% oxygen in the air. You just take it, you're getting it free. You don't need oxygen saturator, concentrator. You don't need oxygen cylinder. You don't need anything. Just by taking a deep breath in, out, pranayama, if you do, your oxygen level is going to go up. Your oxygen saturation is going to go up. You do it morning and evening. And, at least 50 diseases you can prevent due to that. Because somebody was saying that oxygen and water are the most important thing. I agree. Enough water, dehydration you should prevent. Drink plenty of clean water, preferably even warm water or hot water these days. No harm. Should you do steam inhalation? Well, if you want to do it, you do it. I really don't know if any controlled studies have been done. Can't do any harm, but don't burn yourself doing it. If you want to do a light inhalation, I would do inhalation only if you have symptoms, to keep on preventing. Okay, today you do, tomorrow you, how do you know it comes? Every day, twice a day, you're going to do steam inhalation. If you have any symptoms, definitely do inhalation. But deep breathing you can do every single day. Don't worry about COVID. Don't worry about diabetes. Anyway, you have to do it. So I agree with you, Dr. Surendra Gupta. You are perfectly right. Sri Devi, my dad is diabetic patient for 10 years. Can he take the vaccine? I'm scared to get him vaccinated. Why are you scared, Devi? You are also scared. Your father, you should not. You're scared to do it. We have given more than 6,000, 7,000 diabetic patients. We only vaccinate diabetic patients. Touch wood. I'm touching wood now. Nothing has happened. Not even a little cold or thing anybody has had. We are all taking it ourselves. I was the first to take it. You might have seen my social media post. January 16th, when the Prime Minister announced it there, suddenly I got a call the previous day, you be the role model, you come and take it. It's not even planning, and not even one. Suddenly I got a call. I said, okay, let me go. Let me be the guinea pig. If I go and take it, people will be happy. So I took it and immediately posted on social media saying, here, I've taken it, So I've taken both the shots. And so if I didn't believe in it, why would I take it myself? So all my friends whom I know in the profession have taken it. They're all doing well because of that. In fact, in the first round, we heard of so many doctors who died due to, unfortunately, because we didn't have vaccine. This time, luckily, it's come down. I'm not saying nobody will die, but the death rates among the frontline officers, imagine the number of cases they're treating now. Luckily, the vaccination is doing something and preventing, severe It prevents hospitalization, prevents deaths, prevents worse outcomes. These three things vaccination does. And it doesn't matter which vaccination, whether it's Covishield or Covaxin, now Sputnik is coming, others also may come. But whichever it is, you take it, whichever is available. Kameshwari Venkata Velidi. I am both diabetic and hypertension, both under control. I'm vaccinated totally. There she is, Kameshwari. Did you have any side effect, Kameshwari? I'm sure you didn't. I exercise at home. What care should I take so that they will not be affected by COVID? You have done all the right things, Kameshwari. Your sugar is under control. Your hypertension under control. You have been vaccinated fully. You're exercising at home. Follow a diet. Take a lot of vegetables, green leafy vegetables. Take some fruit. Take less of carbohydrate. Try to take little extra protein. This is from the diet point of view. Add pranayama and deep breathing so that your lungs also get the oxygenation that it needs. And then, of course, now try to avoid getting into contact with people. Thereby, you can prevent it. Okay. Karthikeyan, I am very scared to have vaccine. Karthikeyan, I was also scared when they called me. First time I'm the guinea pig. First one among the first in Tamil Nadu, among the first in India to have taken it. Imagine how I would have felt, when I went. And I said, I don't have a choice. I'm a doctor. I'm going to get in touch with people. If I am one of those 1 in 5 million, 1 million or 2 million happens, what can I do? But if I'm not, then at least I'm protected. That's how I went. In fact, my daughter told me, do you have to be the first to take it? Can't you wait for a week? I said, it makes no difference. If I'm going to get a reaction, I take it now. I take it after 10 days or 15 days, I may still get it. So I went and took it boldly, and all of us who took it that day, we are all well. Thank God that we are all well, and so there's nothing to be scared about. You go and have it. If you have any medical conditions, ask your doctor whether it can be taken. Especially if you have a blood clotting problem or something like that, get an opinion from your doctor or any other contraindication for it. Otherwise, you should definitely take it. That's the only way that COVID is going to go away. US has almost vaccinated 60-70% of its population. In another two, they said by July 4th, they're going to completely, every American adult would have been vaccinated. After that, it's gone. There's no more vaccine. There's no more COVID in US. We have only come to a very small percentage of our population. We still got a long way to go. So all of you should take it, and then you should all be ambassadors and tell people to take it. Harshirani, doctor, should the glycemic targets be more tightened as the targets of a GDM? Has tighter glycemic shown to reduce the likelihood of progressing to mucormycosis? Dr. Harshirani, I think if you maintain the usual control itself is sufficient. Most of the people I have seen with mucormycosis had HbA1c of 8, 9, 10, 11, 12. These are the people who get it. If your HbA1c is 6.5, it's good enough. You don't have to bring it to 5.5 to prevent mucormycosis, because then you will get hypoglycemia, you will get whatever. And these values are not absolute, by the way. For an 80-year-old person, we may say even 7.5 is good enough. Whereas for a 30-year-old person, we'll say try for 5.6, try for below 6. They can easily achieve it. So I think depending on the age of the patient, depending on the duration, depending on the comorbidities, whether they already have heart attack, whether they have stroke, whether they have any other problem, we fix the targets. But at least below 7, and if possible below 6.5. How do we prevent mycosis? Manoj Dubey. How you prevent it is, number 1, if you are diabetic, keep your sugar under control. Number 2, judicious use of the steroids by doctors who are treating, so that they don't over-treat by giving steroids when it's unnecessary or in very high doses. And then following hygiene and so on. I think it's possible to prevent. The first round of COVID, we never even saw mucormycosis. What happened at all that time? Now it is coming because number of cases are more, number 1. Number 2, the use of steroids is very high. And sometimes they're giving it, even when it's not needed, and supra-maximal doses. That's probably the reason. Is this infection due to steroid use? Possibly, yes. I think diabetics getting steroid, you've got a double. Even non-diabetic getting large doses of steroid, you can get mucormycosis. If you're diabetic, you can get it. If you're a diabetic with steroid, the chances are much more. So I think steroid use should be moderated. But steroid is life-saving. As I said, if it is life savings needed, it has to be taken. But slowly it can be tapered off also. Sendil Nathan, can you please repeat the name of the sugar patch? Well, it's a sensor. We call it as the Freestyle Libre. Freestyle Libre. I'll type it. It's called Freestyle Libre. If you live anywhere where our branches are there, we'll be happy to give you one. We can even come home and put it for you. Freestyle Libre patch. I'm typing it now. So this Freestyle Libre, it's of two types. There's Freestyle Libre Pro. Now that was the older one. So you just put it 2 weeks and you don't know the blood sugars. But at the end of 2 weeks, when you take it out, it will give you like 100 blood sugars in a day for 14 days. So 1,400 blood sugars. Every day it will tell you the time and range. It will also give you graph after graph after graph. You have a range. The lower should not go below 70. Upper should not go above 180 or even 140, depending on what you set it. And then within that, all the blood sugar should be. If it's going high, we know then immediately the time and range is gone. TAR is gone. We call it as time above range, or TAR. If it goes below, goes to 50, 40, it's time below range, or TBR. So you should not have TBR, you should not have TAR, you should have time in range, or TIR. And that can be easily studied by using this patch. It's called as the Freestyle Libre Pro. The new one which has come is called Freestyle Libre. Now this is mostly for people on insulin, type 1 diabetic patients, where you get not only the patch, a similar patch, you also get the reader. So with the reader, you can check your blood sugar as many times as you want without even one drop of blood. Okay. Suppose you're going to eat now. Okay, let me see what's my sugar. Oh, it's going a bit low. I better have a little bit more food. Or you're in the middle of the meeting of somewhere, you're eating, suddenly you're feeling giddy. You just take that and see, oh, it's 40. My God, I better go and eat now. Okay. Remember that what you're testing here is not blood glucose. It is interstitial fluid glucose. So it is a glucose under the skin where the interstitial fluid is there. Why I'm making that distinction between the two? Because from the blood to come to the interstitial fluid, it takes 30 minutes. Because this is not blood, it is interstitial fluid. So first it will come in the blood, the glucose, then it will come to interstitial fluid. That takes 20 to 30 minutes. Why I'm telling you that is, people have glucometer with them. They also have this reader patch with them. And then they'll look at both. And they'll say, let me do the blood sugar. It is 84. Then they'll read this. And they'll say it's 92. Oh, this is wrong. This is 90. It was 92 half an hour ago. Now it has come to 80. The machine will also show you whether it's dropping or increasing. There's an arrow in that the Freestyle Libre one. It will tell you the blood sugars are rising, rising, rising. Blood sugars are falling, falling, falling. How the trend is going. This is the true art of precision diabetes. I'm very excited because at this stage of my life, after 50 years of diabetes, I dreamt about this and I worked for this 35 years ago in Germany. When I spent a whole year doing research, trying to discover this, and I failed. I didn't succeed. After it took another 20 years, 25 years for it to come. But when it came, I was so excited because I feel that this is the true precision diabetes. And this is how diabetes should be treated. 35 years ago, I recognized that. And my boss in Germany told me, let's do this. We'll find a breakthrough. Unfortunately, the technology was not good at that time. And we were doing it in a university setup in the University of Ulm in Germany. But today, I'm so thankful. I use it in most of my patients. And it's remarkable. If the patient just does that, they're able to adjust their diet. They're able to adjust their exercise. They understand so much more about their diabetes. And those who like it, they're thrilled. They use it so many times. Why parosmia happens in COVID? Well, because of it's a nasal kind of an inflammation. Probably the nerves there are partly affected. Remember, it's only a temporary condition. So when parosmia is loss of smell. So loss of smell can occur in many conditions. Even in a severe cold, you can have loss of even a normal viral flu. You can have sometimes loss of smell and loss of taste. And it doesn't occur in everybody with COVID, by the way. And it can occur even without COVID, by the way. So it is not a characteristic sign, but it's one of those early signs where this seems to be COVID. So, and it recovers after 2, 3, 4 weeks. Normally about a month later, it comes back. So don't worry about that. Subhash Devakar. I agree with you, sir. Every type 1 diabetic should have a photos of Banting, Best, MacLeod, and Collip who discovered insulin adorning the wall of his study. I entirely agree. And people don't realize this, how much their lives are dependent. Of course, I know that a lot of type 1s who are probably in the audience, they write about, they know that the value of this. But the general public thinks insulin is some kind of poison or something. Oh, that insulin, insulin, bad guy. No, 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 good guy, very good guy. He's your savior. I'm not saying that you should go to the savior every time, but keep him as a kind of a reserve. If you have something in our locker which is kept away for a rainy day, it's our saving. We have kept it there, and we may go and use it anytime when we want it. But that doesn't make it a bad guy. If you earned your money in a proper way and you kept it in the bank, it's not a bad guy. You earned a lakh of rupees and that's your saving and you put it in a bank. It's not a bad thing to have that. Tomorrow, if you need something, you can go and use it. Similarly, tomorrow, people are not even having type 1 diabetes, but today COVID has come, steroid has come. Now's the time to use insulin. Use it. It's a life-saving thing, can prevent mucormycosis. So don't hesitate to use it, because if you use it, then you can think. And that's why I think I'm glad Subhash Divekar agrees with me. You must, respect those people who discovered it. But for them, people with type 1 diabetes still may not be alive even today. And today, people are, we have, incidentally, if any of you have finished 50 years of type 1 diabetes, please contact me. I'm having a special, function to honor these people. I've already got a long list of them from India. These are the true unsung heroes of diabetes, because they finished 50 years. Some have finished 60 years with diabetes or even more, and they're doing well. They have no complications, and they've been taking insulin for 60 years. They're the living proof that insulin is a good thing, not a bad thing. Pradeep Mohan, hello sir. It's well acknowledged the diabetes risk factor of severe COVID. What about pre-diabetes? Is it a severe? It's not, Pradeep, it's not as much a risk factor for severe COVID. Pre-diabetes is a risk factor for heart disease, for hypertension, dyslipidemia, heart attacks, strokes, some forms of neuropathy, and so on. But pre-diabetes, already your sugar levels are slightly on the higher side, and then if you go and give them steroids in a pre-diabetic stage, it's going to shoot up. So definitely pre-diabetes is a higher risk than a normal glucose tolerance person. So probably the risk is intermediate between a normal person and a diabetic, but slightly there. I'm taking Dimigen for MS. Is it okay at this time? Narendran Nair. I'm not sure what Dimigen for MS is. I'd like to skip that because I'm not the expert in that. Kameshwari Venkata Velidi again. What dietary supplement should a diabetic and hypertensive person take? Normally, if you're eating a healthy diet, as I told you, half the plate vegetables. Okay, especially green leafy vegetables. Take the vegetables in different colors. Quarter of the plate protein, especially vegetable protein. Bengal gram, green gram, black gram, mushroom, rajma, paneer, whatever you want. Okay, so that's quarter of the plate. Because you're non-vegetarian, you can take fish or chicken or white egg. Then that last quarter of the plate alone, you should reserve for either 1 chapati, maximum 2 chapatis, or maybe 1 cup of rice, maximum. Okay, so that's the healthy way of taking. Those who take like that, probably you don't need any supplements. But if you really need some supplements, there are very good supplements available today, which give you extra protein, which gives you extra fiber, which will not increase your sugar levels. And for those of you who are trying to lose weight, you can replace that meal with a supplement. Maybe instead of lunch, I'll have only the supplement. It's so filling that if you just have a glass of that, you will feel like a milkshake or something, which is a very good supplement. It'll, keep you completely filled, and satiety will be there, and your sugar won't go up because it is low glycemic index. Pankaj Patani, post-COVID, how many days do you need to take oral anticoagulant tablet? Go by what the doctor says, because there is no such thing. Everybody may not even be put on an anticoagulant. It only depends. Mild cases, we don't give anticoagulant to everybody. We just give them paracetamol and some vitamins, and they do well. But if your doctor has asked you to take it, at least for 2-3 weeks, I would imagine, but it's individualized, so I wouldn't like to answer it here. Ask your doctor who's treating you. There's a next question from Edit for us. Good evening. Thank you for your time. HbA1c 7.3, 42 years old. Can I go for vaccination? Whatever your HbA1c, you should go for your vaccination. No doubt about it. Whether HbA1c is 6.5 or 8.5, you still should go for your vaccination. But if you're 42 years old, I would not be happy with your 7.3. I will push harder. I will definitely try to bring it below 7. Because remember, 7, why is this magic figure 7? Is it something we just picked from the air like that? Let me decide which number shall I tell today in this Facebook live. 7 looks like a good number. No, that's not how we work. How we work is science. We do studies on how many people? 5 lakh people, 10 lakh people, follow them up for 10 years, 20 years, see at which cut point people developed eye complication, kidney complication, heart complication, at which cut point they were safe. There are other studies, UKPDS, DCCT from the US, UKPDS done in UK, Kumamoto study, the Steno study done in Denmark. There are so many studies, and we have Indian data. We have the more than 5 lakh patients who have been followed up for 30 years now. All that data points out and says that if your normal HbA1c is 5.6, okay, 5.4, 5.5, 5.6, anything more than 5.6 is pre-diabetic value. Okay, there also we're now publishing a paper. I've just sent it for publication, showing that in older people, if you're above 60, 65, up to 6 is also okay, HbA1c. It's normal. Okay, up to 6.2, 6.3 maybe normal if you're 70 years old. Nobody's going to treat you or call you pre-diabetic then. But if you're 42 years old and if you're diabetic, 7.3 is too high. You should try for near 6, at least 5.6 ideally, but at least 6. Below 6.5 you should definitely, because remember that when you are, now you're 42, by the time you come 48 or 50, to get to 7.3 will be very difficult. Diabetes is a progressive disease, even though WhatsApp media university will tell you that it's not, and everybody can be reversed and so on. It's not true. With age, just like your hair becomes gray or your skin becomes rough or something, your pancreas also begins to dry up. That's part of the aging process, and therefore 10 years from now to get 7.3 will be difficult. That time if you get 7.3 it will be good. So now make it 6.3. So after 10 years we get 7.3, it's good enough. After another 10 years we get 7.8, it's good enough. That way. Now itself is 7.3. After 10 years to get to 8.5 will be very difficult. They are the people who develop complications. So you should not develop complications. Vamsi Krishna, Dr. Vamsi Krishna, dear sir, please comment on pneumococcal vaccination during COVID times. Yeah. So last year, when we did not have the COVID vaccination, we went on a big drive, and we're still having the drive now. We are saying that there are 2 vaccines which have been time tested for the last 20 years or more. One is pneumococcal vaccination. The other is influenza vaccination. Now, believe it or not, even those who took the influenza vaccination, I don't have a controlled study or a published study to tell you that, but my patients who took it are telling me, sir, because you gave us that influenza vaccination, we did not get COVID. Okay, or when you got COVID, it was very, very mild. Some of them got it, but just like this vaccination. Why? Because both are coronaviruses. Even the influenza virus belongs to that family of the coronavirus, and therefore, although it's not the exact vaccination, it is similar. So some protection it may give you. So pneumococcal vaccination is given, it is to prevent pneumonia, to prevent bacterial pneumonia. So anybody who is at risk of getting pneumonia, and a diabetic patient is more at risk of developing pneumonia. If you take the pneumococcal vaccination, you're actually protected for 5, 10, even 15, 20 years, or maybe even for life. Okay, if you take it after 60 years of age, you don't have to take it in your lifetime. If you take it when you're very young, 30, 40, maybe when you're 60, you might have to repeat it once. Just one small injection, that's it. And then for whole life, you're protected from one major disease. Pneumonia is one of the common killers in India. And one disease you've eliminated straight away with one injection, okay, which is absolutely safe. Now, the second one, influenza vaccination. Influenza comes every year. It's a close mimic to COVID. Sometimes you get double infection. I know that in the initial days in Mumbai, people were getting influenza and COVID together. So you're getting a double hit now. Now, that time we didn't have the COVID vaccination. Just giving the influenza vaccination, one disease eliminated. You won't get influenza. Now with the COVID vaccination, take that out, but don't take them all together. So pneumococcal and influenza can be taken one on this hand, one on that hand, but wait for at least 3-4 weeks before you take the take the COVID vaccination. If you're taking COVID vaccination, wait 3-4 weeks and then take these 2 vaccinations. Don't take them all together. So, Parthiban is asking the same question. What role does pneumococcal vaccine play for people who have completed the dose of COVID vaccine? Well, you may not get COVID, but COVID is a virus, okay? And influenza is a virus. Pneumococcal is a bacterial infection. There's nothing to do with COVID. Plus, if you get COVID, you can always get a secondary bacterial pneumococcal infection. Okay. So by taking the pneumococcal infection, I told you it's only one for life. you're protected. So you won't get secondary pneumonia. Many people are admitted to hospital or even from the community, they get what is called as community acquired pneumonia. Big patches of consolidation in the lungs. You'll find the lungs having these patches. All that can be prevented by taking the pneumococcal vaccination. Urvi, hi sir, my brother is 15 years old and has type 1 diabetes. Please let me know how to treat if he gets COVID, how to prevent. He's on insulin support. Just like everyone else, Urvi, your brother also has to wear a mask. And remember that in type 1, the prognosis is much better because they have the advantage of age. Second, people with type 2 diabetes are also obese. They also have hypertension. They also have maybe having little heart disease or dyslipidemia and so on. And therefore, the risk for a type 2 is much more than a type 1. I have seen many with type 1 who have got COVID and completely recovered. My own patients have got COVID and completely recovered. Some of them may be watching this show, and nothing happened to them. So you don't have to worry, but ask your brother, take the precaution, let him wear the mask, let him follow social distancing and all the other things. Then there's nothing to worry. By taking insulin, nothing will happen to him. It doesn't increase the risk or anything. Malika Rani, holding iron supplements for someone. Oh, Dr. Malika Rani. Hi Malika. Withholding iron supplements to someone during COVID is inflammatory. Thank you, Malika. I was reading up about mucormycosis today. When I read about this, I knew about the diabetes connection, but I was thinking, what else can trigger? What else can trigger? Then I found this. If you give for chelating agents and if you give this iron thing, deferoxamine, if you give that, what happens is it takes away the iron from the iron load, from the stored iron, becomes free iron, and that somehow seems to feed into this mucormycosis. The fungus absorbs this iron, and then it helps the fungus to spread. So withholding it during that time for a short time, unless your anemia is so severe, may be a good idea. Not using these agents if you are on it for some time may be a good idea, especially if you are having COVID and during that time. Tasin Chako, should you take aspirin after vaccination? I know, Tasin, you told me the story about somebody, a family who had this thing. So taking aspirin, I think, is a good idea, especially for diabetic patients. I know that there are some doctors who say that if you take aspirin for 2 or 3 days, it's not proven. It's my own thing. It's not a guideline. Nobody has proposed it. It's not there in a book. It is not there in any government guideline or anything. But I don't think there's anything wrong in it. If you're really scared about taking vaccination, take aspirin. A lot of people take aspirin like that, to prevent, heart attacks and all that. A lot of people are taking for primary prevention aspirin. For primary prevention, aspirin is not really recommended. It's recommended for secondary prevention. What do you mean by secondary prevention? If you already have a heart attack, already have a heart problem, if you're diabetic, then taking aspirin is the thing. But general population, everybody taking aspirin, guidelines don't permit it, although a lot of people take it. A lot of cardiologists give it. So nothing wrong in taking for a few days. I don't think anything will happen, but take enteric coated one so that you don't get stomach gastritis or bleeding or anything. Take it after food, and if necessary, take a antacid or a something to prevent antacid kind of a thing along with it, or Pantacid or Zintac or Raviprazole or something along with it. Shafat, my dad is 68 years old, recovering from COVID, but his sugars are fluctuating. Shafat, you should get his sugars under good control. This is the time when, he needs to, he's 68 years old and he's got diabetes. So maybe he was put on steroids, and that's why probably the sugars are fluctuating. If you need help from me when controlling it, feel free to, write to me. Maybe I'll type out our that appointments. Cynthia can probably type out our thing, how to get in touch with me. I'll be happy to send me an email with this what medicines he's taking. I can't do it in a show, obviously. It's not consultation, it's only general information, but I'm happy to help your dad. Okay. Sarika Rangaraj, how long can one take Zincovet and D-Rise? Now, let me answer the D-Rise part. Now, D-Rise, what they mean is vitamin D supplement. Is trade names. Vitamin D is to be taken probably lifelong, because your vitamin D, you have Indians, about 60-70% have low vitamin D. So the only thing is, once in few months you can check your vitamin D to see it's not going very high. But in this kind of a dose that you're saying 2000 IU, I have never seen it go very, very high. Only if you take 60,000 often, or 150,000, 300,000, which some of the orthopedic surgeons use, then I've seen vitamin D toxicity come. Otherwise, 2000 I have never seen. So far, I've been using it for years now. I have not seen vitamin D toxicity at that dose. If it is contraindicated, if your kidney doctor, somebody tells you don't take it, don't take it. Otherwise, you can take it. Zinc Covet, there is a zinc preparations. I'm not even sure whether you should actually take it, because of course zinc is very good. It's an antioxidant, but you can get it in your food. All your pulses that I told you about, Bengal gram, green gram, black gram, the cereals, non-vegetarian food, shellfish, chicken, many of these things contain fish. They all contain zinc, and therefore it's quite easy to get zinc in your food. So just popping a Zincovit tablet, or I'm not saying a trade name, but I'm just saying zinc capsule, swallowing it every day, we don't know the long-term effects. We're not measuring zinc in your body. So unless your doctor says you've got a deficiency, there are certain zinc deficiency syndromes. There are some skin problem, this problem, then you can take it under doctor's advice. Simply taking it to prevent COVID, you won't prevent COVID just by taking the zinc. Okay. Prasanna Alavala. What can be used as alternative for amphotericin B? After using for 6 days, creatinine levels are spiking and potassium is dropping. Sorry to hear that. That is a problem. So I hope we don't get too many mucormycosis. I mean, there are different formulations of amphotericin B. There is a liposomal one and a lipid soluble one. I'm not a big expert on amphotericin B because I don't treat too many mucormycosis. I've treated one or two in my career, which is some years ago, and at that time we had only one brand, and I agree with you that the creatinine goes up and the potassium drops. But for both of these, I believe the newer preparations are much better. That's what I have read, but they're also supposed to be more expensive. They're horribly expensive. So probably somebody who's treating a lot of mucormycosis may be able to tell you that. I was trying to tell you more from a diabetologist point of view. Prevent it by good control of diabetes. Prevent it. That's what I was trying. I wanted to give that message. That is one more reason for you to control your diabetes well. And that was the whole point about that. Palak Andani. My son is type 1 diabetic. Sometimes sugar reading just spikes. What can be the reason? How to control it? Last 1 year. Today, first time is reading reached 390. Gosh, that's not good, Palak. And you can get it under control. I would suggest you put this patch if you can get it, and then you see what he's eating, because usually it is a carbohydrate that you take. So you must measure, you must do the carb counting, and you must measure the insulin based on the carb, the ratio, insulin carb ratio. So you see for every 15 grams of carbohydrate, this much unit of insulin. Of course, insulin sensitivity varies, so you can adjust it and see. Especially wearing the patch, one day you take a certain amount of insulin. Let's say you're taking 12 units of insulin, but your sugar is going high. Next day you try 13 or 14 and see how much it came down. It came down so much. So let me try one more, 15. Now it has come down. Now it's normal. So 15 is your correct dose. So like that. The other thing you can do is you can reduce your carbohydrate intake. You can divide your carbs. For example, if you're taking, he's a growing child, so he needs calories. Let's say he's taking idli. Let's say you're in South India, you're taking idli. Instead of taking 4 idlis at one time, let him take 2 idlis at 8:30 and 2 idlis at 10:30. Both the peaks will, having one big peak, we'll have 2 small peaks. Then the sugar won't go to 390. It may go to 200 only. And the next one may be only 160 or 180. So that way you can cut it. It's very easy. It's like mathematics. 2 plus 2 is 4 in mathematics. Here it's not 2 plus 2, 4. In biology, 2 plus 2 can be 3.5 also. It can be 4.5 also. It can be 4 also. That is a challenge, but that is also the excitement that it gives us when we treat patients, because then we know, we must fix this person's accurately, precision diabetes. So if you write to me, Palak, with your son's treatment, I would be happy to help. Okay. And I will share which email ID you should use at the end of this program. Kalai Raj, my mother is in hospital suspecting COVID, is having diabetes, unfortunately not given medicine during hospitalization. Her eye of one side is swollen, suspecting mucormycosis. mucormycosis. Good Lord. So sorry to hear that it's already picking up. I thought, I was early in giving the message. Well, Kaleraj, all I can say is that a high index of suspicion is needed for mucormycosis. You must be looking out for that. But why would they keep them in hospital and not given medicine during? I can't understand why that is so. And you've not said whether she's diabetic or not. Get the sugars down in an emergency and then start treating this. There are ways of finding out whether it's mucormycosis. You have to show the, the high five, we call it. They're at right angles like that, it will come, like a T, 90 degrees. If you find the fungus like that, it is typical of mucormycosis. You should think about it and then see what is to be done. Then Krishna Raj, I am Barnidharan, 39 years old. I have Dubin-Johnson syndrome. Can I take the vaccine? Is there anything dangerous? Please tell me. You must consult a good general physician and do that. Anybody having such syndromes and all that, you have to be little careful and check it out before you take it. Anybody with any doubt, better check it. What I meant was everybody go and take. If you're a normal, healthy person, you go and take it. But if you're having something, please check it. Please look up the literature, because these are new things. The COVID vaccine, how old is it? 3-4 months. Nobody has that much experience. Nobody might have even seen somebody with Dubin-Johnson going in for COVID vaccine. So check it up and then take it. Don't blindly go and take the vaccine. Roshan, hi Roshan. I'm a juvenile diabetic having long term. Yes, 40 years under my care. I've got fully vaccinated, no side effects. I needed somebody to say that. I would urge all to take the vaccine, protect yourself. Well done, Roshan. That's it. So I wanted you to give that message. She's got type 1 diabetes. She's got 2 boys who are growing up very well. She has her HbA1c is always under control. Ideal patient. 40 years with insulin and doing very well. No complications. Had full vaccination also. What more success story do you want? It's not made up. You can ask Roshan. She's a true person. She's not a robot or she's not a made up case. Okay. Usha Balasubramaniam. Doctor, very rarely I forget the oral which I have to take before food. Can you take it out food or skip it? Don't skip it. See, the idea behind taking it before food is it starts working early. That also goes for the father of the type 1 patient who asked me. The other way to bring down the postprandial sugar for your son, Adnani, I think, is take the insulin a little earlier. If you take the insulin, if you're taking it now just with the food, try taking it 15-20 minutes earlier. Still not coming down sufficiently, it's come down, but take half an hour earlier. You'll find the same dose, you'll find it's coming because you're giving more time for to work. Similarly, for Usha, if you take it before food, it will help to control the postprandial. But you forget, we are human beings, we can forget. Take it. That particular day, 20 milligrams more, it will go. But if you don't, then it will go very high. So here on the screen, you will find this is that. If you want to contact me for those 2 or 3 people who wanted some advice about insulin, it's called appointments dash GOP. GOP is for Gopalapuram. So appointments GOP at drmohans.com, and that's the telephone number. That's also a website, www.drmohans.com. This for is not for the appointment. Okay, the email ID starts at appointments dash Gopalapuram. You can put it up again at the end of the show, Cynthia. Then Aparna, sir, I have 5 years type 1 diabetic kid. How to protect her in this pandemic situation? Don't worry, Aparna. For children, it's usually okay. Here's the right one. So appointments.gop at drmohans.com. Copy that if you want to take a picture, and then you can write to me later. Aparna, so don't worry. She's only 5 years old. The little kid. Nothing will happen to her. Keep her safe. See that, from maid servants, these are kind of people who bring it into the house. Keep the child protected. Keep the sugars under control, and don't worry about it. She's going to be fine. Just don't worry about it. Okay. There's another little princess, but my fasting blood glucose are high, about 350. Oh my God, that's bad for the little princess to have a blood sugar 350. Not at all good. You must bring it down and bring it down fast. Okay. Because these are bad times to have sugars like that, your fasting should be 100, okay, 100, 110, not 350. So if you're on, I presume that you're also type 1 diabetic or whatever, and I presume that you're on night dose of insulin, the basal insulin. That insulin, you increase it little bit. Let's say you're taking 12 units. Try 14, see how much comes down next day. It's only come down by 20. Try 16, see how much it comes down. Then still not come down. Try 18. In steps of every 2-3 days, 2 units at a time you increase. Fix the fasting first. That is a principle I teach all my fellows and doctors and juniors and everyone whom I teach. Fix the fasting first. 3 F's. Fix the fasting first. If you're not fixed the fasting, you get up in the morning with 350. How are you going to control the rest of the day? When you eat after breakfast, how is it going to go? It's going to go even higher, 450, 500. So unless you bring the fasting down, how are you going to control the rest? So fix the fasting first. Okay. Palak Adnani is back again. My son is type 1. Sometimes sugar reading just spikes. I answered that. Okay. So I said, if you write to me, I'll help you to get his sugars under control. It's a question of adjusting his diet, especially the carbohydrate, matching his insulin to that, and seeing that it's brought under control. Swagat Guitar. Loved your book, sir. Very inspiring. A must read, especially in these trying times. Thank you so much. I presume you're talking about my autobiography, Making Excellence a Habit, because I've also written another book called Satya Sai Baba Lives On. And that's also an equally popular book. That's in 6 languages, actually. But this book, you're probably meaning this one. Please do write a review on Amazon. If you have liked the book and you bought it from there or from whichever you bought from, please write a small review. That will be nice. So that that book was written mostly to inspire youngsters and to inspire people to live a happy life, a healthy life and a happy life. So for those of you who have not read it, I'll show you the book. 1 second. That's the book, Making Excellence a Habit, the secret to building a world-class healthcare system in India. And it's available, it's published by Penguin. You can see the thing there. And that's Penguin. And it's available on Amazon. And if you have not read it, it's not just for people with diabetes. Anybody can read it. And I'm sure, like Swagat, you also may like it. Lakshmi Satya, HbA1c once in 3 months. That's ideal, Lakshmi. Once in 3 months, it's a 3 months test. If you can do it once in 3 months, it's ideal. I normally tell patients to do that. If not, at least once in 4 to 6 months. If you can't afford it, you don't have a place to do it properly, at least 4 to 6 months. But we have found that those who do it, say 3 or 4 times in a year, they do very well. And they don't develop any complication because they are adjusting and keeping that A1C. If you keep your A1C below 7%, you will not develop diabetic eye disease or kidney disease or nerve disease in your lifetime. Guaranteed. I'm telling you, quote me. And said, Dr. Mohan said, if you keep the HbA1c below 7%, I will not develop diabetic retinopathy, nephropathy, that is kidney or nerve complication. It's proven. It's proven. There's no doubt at all. It's been proven beyond doubt by everyone. So that's why you should keep it under control. Lakshmi Satya, your talk gave me a hope I can control my diabetes. I'm doing exercise. My PP is 175. Having medication, is it okay? Lakshmi, 175 is okay, but I would say, depending on your age, you've not told me your age. I'm not going to ask your age also. Shouldn't ask a lady your age. I'm not going to ask. But unless you're very old, if you're, say, 75, 80 years old, which I presume you're not, then 175 is okay. But if you're not, if you're only 30 years old, 40 years old, something like that, there is scope to bring it down a little better. Postnatal 175 is not really normal. We are trying to keep the blood sugars of a diabetic person as near normal as possible. A normal person blood sugar doesn't cross 120. Okay. So I'm not saying everybody should come to 120. At least 130, 140 will be a good ask if you can get it. If not, if you have got a little more difficulty, 150, 160, now you want to 170. So I'm not satisfied. If you ask me, if I'm a teacher and you tell me, I've got 90% mark, is it good enough? What will I say? No, 100 is what you should get. You know? That's my expectation. I know everybody is not going to get 100, but that's my aim. If I aim only for 90, I'll end up 70 or 60 marks. Okay. So a good teacher will try to get everybody 100. So at least near 100 they will get. Okay. Write to me, Lakshmi, if you want further help. Devendra Shrimali. Is insulin anabolic hormone? Yes. Yes. What is anabolic hormone? It builds up your body. It builds up your tissues. And that's why some people, when they take insulin, their weight goes up a little bit because it's an anabolic hormone. But if you do enough exercise, that weight will not go up. So for those who are underweight, this is the one to use because it's an anabolic hormone. Catabolic one will break down your body. Okay, completely breaking it down. That's not what insulin does. Insulin is an anabolic hormone. It helps you. Cherumbal Narayanan. I am COVID affected, now in hospital, isolation period over, next vaccination due on 12/6. After 3 months gap, can I take it? I think after 1 month it's okay, Mr. Narayanan. 2 months is fine. 3 months is fantastic. I don't recommend taking it immediately after COVID. I'll tell you that because I've seen one instance where one of my colleagues, I know of, his wife actually took it and had some bad reaction. So after COVID, minimum 4 weeks. At the end of 4 weeks, I think it's okay. 2 months is even better. 3 months is, too long probably. If you're going to take in this kind of a situation, 3 months, the COVID itself may be over by that time. So if you're going to take it, you take it a little earlier. Will COVID vaccine develop antibodies for SLE patients? Not sure about that. I'm not the expert in SLE, so I wouldn't like to comment on that. You should ask your rheumatologist what they say. But normally, there's not so much of cross reaction. Produce antibodies only against COVID. That's the best of my knowledge. Naga Shravanti. Hello, my son is diagnosed type 1 diabetes 1.5 years back. Still, he's not able to accept this, how to manage himself. It's not easy, Naga Shravanti. If I was your son, I will keep on denying it. And also depends on how old your son is. Younger children accept faster. If they're in the teenage, it's very difficult for them to, why me? They'll keep on doing that. I think what he should do is he should meet others with type 1. There are so many type 1 diabetes foundations. I hope some of them are in this meeting. And so there are a lot of type 1 diabetes foundations. I know that Harsh Kohli runs one. I know Jas Sethi runs one. I know that the Blue Circle Foundation of Nupur Lalwani is there. There are some in Tamil Nadu. There are some in every state now has some of these. You must find your own, group of people. We have our own, we call it Friends Forever, where all our type 1, children meet, where the older ones tell the younger ones, look, I've been taking, just like just now, Roshan just now said, I've got diabetes for 40 years and I'm doing well. When you hear that, oh, Roshan also got it young, but now 40 years later, she's doing well. That is a kind of stimulation that you should have. That's a kind of inspiration. Whenever I say it, people ask me, do you have type 1 diabetes? No, I don't have type 1. Then don't talk. You don't know what is insulin. Correct. I don't know what is insulin. I have not injected myself 4 times a day. So I cannot empathize with you like a person who has type 1 diabetes, who is injecting 4 times a day, or is on a pump or something and injecting the blood, checking the blood sugar so many times. They'll be able to have a much better connect than me. I can only give you the science. I can only give you the evidence. I can only tell you as a diabetologist in practice for 50 years who has treated and seen more than 5 lakh diabetic patients, probably about 8,000 type 1 children I have seen in my lifetime. That experience I can share with you. But you ask me, do you have type 1? Have you injected? I'll say, no, sorry, I didn't get type 1 diabetes. So I can tell you what others have told me, but the others will be able to tell you much better. So join one of those groups. There are a lot of groups on internet. There's a Blue Circle Foundation, there's Diabetes, and there is the Diabetes in Young India Youth Action, and there are so many others. So you join one of those and they will be able to guide your son much better than even I can tell in this program, Naga Shravanti. Raju Stathunathan. After 25 years of diabetes, HbA1c is 6.8. Now that deserves a big round of applause. After 25 years, HbA1c is 6.8. That's a spirit. But I have peripheral neuropathy. That's why, Raju. First of all, whether you had 6.8 throughout those 25 years, I don't know. Second, Neuropathy is not a specific complication of diabetes. Okay. Now, HbA1c must be below 7 throughout your life. Have you had that? I don't know. Number two, even if you have had that, there is something called age-related neuropathy. People without diabetes get neuropathy. Anybody after 50, 60, now I am above 60, you check my nerves now, you think it will be like I was a 30-year-old person. I may be having mild neuropathy now because I'm an older person. Okay, I've got gray, you can see gray hair, only got gray hair. I don't have diabetes, but still the age is showing, no? So like that, there can be, so it could be just the effect of your age. What I meant was, you will not go blind due to diabetic retinopathy. You will not lose your limb due to diabetic neuropathy. You will not have kidney failure needing dialysis transplantation due to kidney. If you check your eye, you might find one small spot there. Don't say, oh, Dr. Mohan, you said you won't develop retinopathy. I meant severe retinopathy. You can prevent blind. If you want me to correct myself, I'll say that if you keep it below 7, in your lifetime, you will not go blind. You will not have renal failure. You will not have an amputation. You will not have complete loss of sensation in your leg, leading to insensate foot or something like that. Those things you will not get if it is below 7%. That's what we are interested in now. Theoretically, academically, if there's one spot in the eye, so what? Let that spot be there. Even people without diabetes can get one spot in the eye. So don't worry about that. An empty stomach fasting is 130 to 140. Please guide me. Suraj Sinha. Depends on your age, Suraj. Father sugar. Okay. Depends on his age. If he is older, 130, 140 may be normal. I cannot say in this program. I have not seen his age. I don't know his other parameters. Suppose his creatinine is a little high. He has some other problems. Maybe this is a fairly good blood sugar. But if this is a young person, who's 20 years old, I'll say aim for tighter control. Okay. If you want help, write to me. I'll tell you. Shubhankar Sengupta. Is low potassium level serious? She's 72, type 2 diabetic, supposed to be discharged from hospital today. Potassium 2.2 is dangerous, Shubhankar. I don't know why they are discharging from hospital. Maybe you're asking because they said to stay in hospital. 2.2 is dangerous. Okay. So the normal level is between 3.5 to 4.5. So anything above 5.5, 6 is dangerous. And similarly, 2.2 is dangerous. But there are medicines to increase the potassium, which they will do, and let her at least come to 3.5 before it's discharged. This is called hypokalemia, sudden irregularity of the heart and all that can come. It's not dangerous, it is treatable, but going like that, leaving it alone can turn serious. So get it normal, get the treatment for that, and then go. Ramesh, type 1 advanced treatment, tell me. I don't understand what you mean by advanced. Oh, any advanced treatment. Oh, you mean whether you can stop insulin or do stem cell treatment, pancreas transplantation, and islet cell transplantation. These are three things which everybody will ask. Pancreas transplantation has been done for about 5 to 10,000 people in the last 50 years in the world. Okay, among the millions and millions, about 5 to 10,000 people. Usually done along with kidney transplantation. And if kidney failure comes, they may do 2 transplants because only one immunosuppression is needed. Isolated islet cell pancreas transplantation is not so common. It's a drastic procedure, no doubt. A few, maybe in India, some 5-10 people or 20 people have done it. It's not an easy procedure. It's a costly procedure. You need to take immunosuppression because you're taking somebody else's pancreas from a dead body or from some donor. So it's a complicated procedure. It can have side effects also. You have to be careful. Much simpler to take insulin. Like Roshan, for 40 years, you can take insulin, do well. I'll be more happy doing that. Islet cell transplantation even more difficult. You have to take the beta cells out and then put it and so on. Stem cell treatment may come. That's what I'm hoping for. That they'll produce in the lab, just like they produced insulin. They'll produce in the lab, and you can go once a year, take one shot of stem cells, and which gets converted into beta cells. That can come, but it has not yet come. It may come in the future. Right? We don't know when. Thanks a lot, dear Sir the Pride. Thanks a lot. Like all these names and nicknames which people use. Thanks a lot for valuable suggestion. Post-COVID, I have central eye, left eye, central serous retinopathy. After taking medicine, it's not related to mucormycosis, not at all. So central serous retinopathy is a CSR. It's a fairly harmless condition. It should settle down, and it may not be post-COVID at all. I have seen it occurring in people with diabetes, without diabetes. So CSR is a treatable condition. I don't think it's related to As you said, it's fine now. You yourself have said it's fine now. It's not. It's a harmless condition. Can be treated. Sometimes with laser, sometimes without laser also it can be treated. Mohana Krishnan, so many people. I think it's the highest I've ever had in a show, and that's why I'm happy to continue, because if I'm helping and touching lives of people, why not? So Mohana Krishna, can a rheumatoid arthritis patient take COVID vaccination? I think you can, but it's but you must ask your specialist and then take it. Somebody asked about SLE also, rheumatoid. These are all related conditions. They're autoimmune conditions. Ask your doctor and then take it. Tangamani, for diabetes post-COVID recovery and test, any test needs to be done. Any specific screening for diabetic complication? Tangamani, test. Normally we do a RT-PCR to say that you are negative. You don't need to do it. There's no protocol to do it. But if you are going to come in touch with others, then better to show that you have become negative. Then you can safely go and mix with people, because you won't infect anybody. Screening for diabetic complication, I think those who have had diabetes should check your kidney, should check your liver, should check your hemogram, should check your eyes. You should check, because the other person says that after that he developed central serous retinopathy. So all the complications, including HbA1c, liver function, everything needs to be done. Do you think continuous glucose monitoring like Dexcom are affordable to Indian? Are they actually helpful? Well, I'm not going to talk about particular brands, Ananda Krishnan, because I know that Dexcom is very expensive, and therefore Dexcom withdrew from India. Nobody could afford it. There are much cheaper ones. There are much cheaper ones which are affordable. And actually, if you calculate the cost, it comes to 1 rupee per test, because 1,400 tests you are able to do for that cost. I think they are fantastic. They are fantastic because they tell you how to adjust your diet, how to adjust your exercise, what insulin to take, what tablet to take. It gives you a time and range. It gives you so much you understand. It's a great motivator. After seeing that that is how all my type 1s have been able to bring their sugars down. They say, oh, this went up at this time, then I'll do this, I'll do that. It's a great motivator. There is like, cell phone is very expensive. Should I have it? Well, you can live without a cell phone also. You can live with a landline also. But you know how many advantages you have if you have a cell phone. It's something like that. It's not that you can't do without it, but it helps you so much that I would say, why not use it? For a person with diabetes, it's definitely worth it. Shafat, my mother is 68, lung problem for 4 years. She's on steroids every day. She's diabetic. How to control her blood sugar level? Well, it looks as if for the lung condition, she needs the steroids. The dose of medicines have to be adjusted, Shafat. You can bring the sugars under control. If you have any problem, write to me. The appointments thing is going on. So if you just send me a mail with all the details, we'll be able to help you. There's nobody whose sugars cannot be controlled. It can be controlled. Tiger Dhawan, blood sugar 290, 30 years old, COVID positive. Gosh. Tiger Dhawan, get your sugars under immediate control. This whole program was about that only. Treat your COVID. Don't take it lightly. You're 30 years old, but you have diabetes and your blood sugar is 290. Maybe the 290 was after the COVID treatment due to the steroid. I don't know the full history. I don't know they're diabetic and then you have blood sugar 290, or because of the steroid given, your blood sugar went to 290. Either way, get it under control, because steroid itself is a risk factor for mucormycosis. So get the sugars absolutely under control and get your COVID treated. I'm sure you'll do well. You're a young person, you'll do well. Charu Arya, your talk is very reassuring during this time. For COVID recovery, what is the role of nutrition? Any role of protein specifically to manage? Thank you, Charu Arya. I'm happy that you're benefited by that. Nutrition is very important, and protein is something which builds immunity. We know that Indians don't take enough protein, especially vegetarians. So for vegetarians, take a glass of milk, take Bengal gram, green gram, black gram, one protein with every meal. Try to have a little protein in the morning, little protein in the afternoon, little protein in the evening. That will build up your. If you're non-vegetarian, it's easy. Take fish or chicken, bite of the egg, whatever you want, plus these vegetable proteins and a glass of milk. That will give you enough. If you still need protein supplements, you're a vegetarian, not able to get enough protein, you can take, there are a number of protein milkshakes and so on. I don't want to give brand names, but they are very, very good and they give you excellent protein. They also taste very good. Earlier, the taste used to be horrible. Now they are fantastic. Get it in, pista flavor or chocolate flavor or vanilla flavor, and they're all very, very good. You can take, they won't increase your sugar level also. I'm a diabetic patient. Is it okay to fast? Shakila, I presume you're talking about Ramadan. Well, there are Ramadan guidelines which have come, and there are low risk, moderate risk, and high risk individuals. High risk individuals should not fast. If you are taking 4 times insulin per day, or type 1 diabetic patient, I think your religion itself tells you don't fast. So those people are given exceptions, exemptions. But others who are at the low risk and the high risk and the medium risk people can definitely fast. Between the iftar and the suhoor, you have to adjust your the timings of the medicines and your diet when you break the fast and all that, and you can adjust. You can fast. Vishal Shah, my father-in-law contracted mucormycosis. Oh my God! See how many people have already got. He's recovering now. Any specific guideline? See that the sugar is kept under absolute control. Insulin is a must. You must see that it's kept under control, Vishal Shah. I'm happy that he's recovering. Please see that he is beautifully controlled. Usha Ramanathan, I'm 62 years old. Your patient. I've developed diabetic since February 2021. Consulted your clinic, taking medication by Dr. Jagdish. Fasting blood sugar is 95. PP is 103. I'm happy. Very well under control. I am ITP patient with platelets low, so my mTOR prescribed Dapsone. Taking it 5 years. HbA1c is showing 2.5. Dapsone will give a false positive HbA1c. We have published that. Dr. Ranjit and I have published that. When you take Dapsone, falsely low HbA1c will come. So don't go by the HbA1c when you're taking Dapsone. It's a false thing. It's not 2.5, maybe 6 or something like that. So that explains it. See, look at that. Your blood sugar was 359 and 542, and look at your blood sugar now. Congratulations to you and to Dr. Jagdish for bringing it down. Now your blood sugar is, you said, completely normal, you said, no? So 95 and 103. So from 359, she's brought her sugar to 95. From 542, she's brought her sugar to 103. HbA1c is low because you're taking Dapsone. So Dapsone is one of the false low HbA1c. I published that. I discovered that and I published that. If HbA1c is below 6, Jagdish, 6 or 6.5, is it possible to keep diabetes control without regular medication diet control, when actually we should start medication? It depends. For some people, without the medication, the sugar won't be under control. So you have to take it. For some people who have lost a lot of weight and have reversed and become normal, you don't need medication. So there's nothing wrong in taking medication if you need it. Remember, it's a lifelong condition. So most patients, if you ask me how many patients need diabetic medicine, 90% will need diabetic medicine. Otherwise, they will not get under control. After 6 months, they'll come back with HbA1c of 12, 13 again. But if you don't need it, your body will start getting low sugars. Then you'll probably stop it. Okay. Sri Harsha Astwa Narayana. Is it safe to take gliptins? Is a side effect of pancreatitis with gliptins? Is it easily treatable? So far in my life, I have probably not seen pancreatitis. I've probably treated 40,000-50,000 people with gliptins. I have not seen pancreatitis so far. I think in India so far 1 case has been described. At least a million. How many millions would have been treated with gliptins? I think 1 case of pancreatitis has been reported from India, published. Maybe 1 or 2 more. So it's very, very rare. If you have pancreatitis, you better not take gliptins. But gliptin producing pancreatitis is more of a theoretical thing. Okay. And if you get pancreatitis, of course, you have to treat it. It is treatable. Tried Prakash Rao, tried CGM after seeing your video, made me to control food, very useful. Thank you, Prakash Rao. Somebody asked whether it's necessary, and here is Prakash Rao saying that after seeing my video, he controlled it. It's fantastic. You know, it's like a, like having a gold mine with you if you have this technique with you. Swati Amar, our daughter took Pfizer in the US. She has rheumatoid. Good, Swati. I'm glad. Nischinta is her daughter. She has rheumatoid arthritis, and she has taken Pfizer vaccination in the US. So I'm sure the others are also can be taken. Incidentally, I just want to tell you that I saw a fake video which says that if you take Pfizer vaccination, it came today, saying that if you take Pfizer vaccination, you will develop Alzheimer's. I don't know how quickly you can develop Alzheimer's in 3 months' time. That itself I knew must be a fake. You'll develop Alzheimer's, you'll develop Parkinsonism, you'll develop this, you'll develop that. Then when I did the thing, it was a fake report published in a fake journal. There's a lot of fake going on. I don't know why people confuse. When people are dying due to this, at that time to produce fake thing, it's criminal. So those are taking also will stop taking it. Remember, almost 70% of USA has already received the Pfizer vaccination. I'm not even using Pfizer. I'm not anything to do with Pfizer. But I'm just telling you that because Pfizer was mentioned, I'm just saying that. So that's all fake news. And then they've done the research on it and showed it's fake news, and they proved it's fake news. The guy who was published is a fake guy, is a fake journal, it's a paid journal, and somebody probably wanted to kill Pfizer, and so they did it like that. This is the kind of wars which go on, between different companies trying to kill another company. In the process, people get confused. So to sum up, ladies and gentlemen, we come to it's almost 8:40, 1 hour and 40 minutes. I've been talking. I didn't realize that. To sum up, these are difficult times. We are going through one of the worst period in my life. I've never seen a worse period than this in my life. But stay positive. This too shall pass. It will soon become history. You will then tell your children and your grandchildren how you passed through these difficult days, and you survived to tell the tale, and how you looked after your diabetes very well. That despite having diabetes and despite having everything else, you still came out. Even if I had COVID, I came. How many people had COVID now? I came out of it. But remember, if you don't control your diabetes, not only COVID can get worse and you can have very bad outcomes. Now deadly diseases like mucormycosis have also begun to emerge because of a large dose of steroids and so on being used. So stay safe, keep your sugars under control, keep testing, come to the diabetic center, or have your tests done so that you remain safe. So on that note, I'll take leave of all of you. If you have any further doubts or anything, please don't hesitate to contact me. I always reply because you are very close to me. I love you all. Take care. Bye bye.